So to follow up on the request that was made from the last video, about what I did was identify two common reasons people have low back pain. One of them being that dumping, so a dis or misengagement of the core. And when I say core, I'm talking about TVA, transverse abdominis, that deepest layer, which causes a dumping to occur in the front and an excessive tightening in the back. So the muscles are now very strong, and they're recruiting the fascial network in the low back, the thoracolumbar fascia, to densify, thicken, and shorten to help offload some of the forces coming down. The second reason for common low back pain, as I mentioned, is that adaptive shortening that comes from iliopsoas, psoas major specifically being the big player. And so when I'm in this position, think about it. If you're an office worker, that's potentially 8 hours roughly behind a desk in this position. What about your commute? Whether you're on the train or you're driving, you're going to be shortened as well. And then also exacerbated by sleeping. So if you're sleeping 8 hours a night, or even 6 hours a night, okay? I mean, 4 nights at 6 hours a night, that's 24 hours of postural re-education you've just given yourself. So sleeping, commuting, and work, all factors in shortening here. So if either of those two or the combination resonated with you, and those are issues, here's 2 things you can do to help start the journey to offsetting these imbalances. Definitely consider body work to at least create the openings so that then these exercises will be more easily accommodated and accepted by your body. So the first one, all I want you to do, this is for your transverse abdominis, your deepest core, is engage in a way, do whatever you think you need to elicit the sensation of your vertebrae lifting off one another. Your low back just lifting, unstack the vertebrae, feel that lift. And I want you to do it in a way that I'm doing it right now, that you still feel supple. You still feel like you can take a full breath. Okay? I don't want you to be like, I'm doing it. Not like that. So elicit the sensation of the lift. That's priority. Secondarily, what I'll recommend or encourage is actually, if you were to envision your pelvis being a bowl full of water, if you're like this, you're dumping. So you're spilling your water. So you want to actually create a nice level playing field for that container so that you don't lose that water from your basin. So primarily, do whatever you need to elicit that lift. Secondarily, be mindful of stabilizing that pelvis. Other cues in the past for TVA is to cough or clear your throat. These are other cues to activate, or bring your belly button in and up. So that's what I want you to more focus on, is just eliciting that lift, okay? And the last thing I'm going to show is a stretch. So this is for your psoas. You're going to come down on all fours like this. If I don't do anything and I just collapse, I can go very deep into this. This is not actually creating an effective stretch. What I want to do is create a strong foundation first. So from this position, 2 things. Create that lift that we just talked about. So create a pelvic tilt, get that lift, engage the glute on the lunging leg, and then come forward maintaining the lift. This is as far as I can go. And now, just like wringing out a towel, your muscle is made up of many fibers. So if I just go into one static plane, I'm not really effective at wringing out the towel. So what I want to do is bring a little bit of motion into it. So just like a towel, if you got to wring the water out, you're going to twist it. So twist those fibers. Once you get set into a spot, there's a little bit of discomfort but no pain. Settle into that, and then start to bring a little bit of movement into the space. Because now it's becoming more of a muscular stretch, and you're also getting the fascial compartment. Because remember, the fascia is basically the big onesie that surrounds your whole body. So explore the ranges, find those areas that feel good, and settle into it. As far as stretching protocols go, one that I find really works well is you go into your stretch 3 times for 10 breaths each time. 10 breaths, about a minute. The first round, you're recruiting all the fibers. The second round, you're setting the fibers. The third round, you're now helping re-educate, retrain, create a new habit. So, I hope you listened all the way to the end. Merci Rachel pour avoir demandé pour faire cette vidéo. And that's all I've got.